pilot project which sees people living on the streets in Cape Town, even those without identity documents, to be vaccinated against COVID-19 has kicked off here in Cape Town at the moment at the Hope Exchange, an NPO assisting people living on the streets. We understand that a total of 250 vaccine doses have been made available, of course the Johnson & Johnson vaccines. But joining me to speak about this program and the need to vaccinate people living on the streets due to their vulnerability is the MEC of Health in the province, Dr. Noma French Mbombo. Dr. Mbombo, very warm good morning to you. We've seen this centre was a hive of activity since early this morning, but a month or so ago you were here speaking to the NGOs about their concerns around vaccinating the homeless. Talk to us a bit about this pilot project, if it's only happening here, and what your plans are to roll out to other centres across the metro and the province.
Yes, indeed. A month here, I came here in response to the calls by the homeless communities through the NGOs, which is they've always been working around with the homeless, together with the other spheres of government, including the city. I think the issue was about the vaccination, so I responded immediately because at the end, irrespective whether you're a billionaire or you're a homeless, if you've got COVID, if you meet that criteria of a high risk, being high risk, you will end up in our health facilities. So I asked the team to dial whatever they must, because we do know that with the homeless, they won't be able to come to the clinics because they are not familiar in those kind of the mainstream surroundings. And also number two, it's about we need to make sure that we provide a type of a vaccine like a J&J where that they don't even have to come back for the second dose. And then thirdly, in as much as that other spheres of government like the national, through the Home Affairs, in regard to the IDs, it's their responsibility to ensure to assist, because as we know that people have to be registered on the EVDS. But what I said to the team, I said that now we know at the time that at the national level, they will be opening up for other categories of the people, and where you find that a sector can be able to have the names and all of those. So already here, they identified 10 sites possible throughout the shelters throughout the provinces where we could be able to make use of. So currently in Belleville, they have started. We are here now as part of the pilot just to see how it works. And already we are being assisted by the nurses from the other NGO, I think St. John's, and all of those. So I'm very excited. Remember, this shelter is the only one that provides showers for the homeless. They come anyway in the morning for the breakfast and then they go. It's also the shelter that also provides, I think they call it phase 2, for the others who are working but also are being homeless. So Minister, we're excited about that.
Minister, the issue of people that don't have identity documents, and the last time we spoke, I think a study showed that about half of the people, and the estimates at this point are that 14,000 people living in Cape Town are homeless. What is the target then that you will be setting in terms of your department to reach a large percentage of those that are homeless, especially those without documentation?
Yes, at this stage we are still using the age category, which is the 35 and above. Now, there are those who do have an IDs, which is the shelters they identified. There are those who don't have IDs, but they recall their ID numbers. And remember, there are people who have been homeless on the street for a decade, and they being known, they will have been attending this shelter for quite a long time. So they become part of the family. They are being known. And then there are those who can't recall their ID numbers, and also some of them might have some mental issues. But you'll find that they've been part of the family of the homeless. So we rely on people like a reverend and others who are able to identify because they know them. So for us as health, it's about at the end, whether they've got an ID or not, you are a patient to us. But we rely on them to make sure to say that, oh, this Auntie Sarah has been here on the street for 10 years or so, and is about over 35. So we do make that kind of a documentation, because at least they will be able to know that you cannot repeat vaccine elsewhere. But also they will make sure, because they will come anyway for the breakfast and so forth, they'll be able to make sure in case there are adverse effects of the immunization and all of those, they'll take responsibility. Remember, it's still supposed to be the responsibility of the national government through the National Command Council for the COVID to come up with a framework on how we deal with these issues. And the Home Affairs is supposed at least also to assist in this regard. But we cannot wait for longer. Because like now, not only when the third wave, we are being dubbed as an epicenter. And the more you know that you are vulnerable, like a homeless, the more actually you'll be exposed to the virus. And those people will land in our hospitals.
Minister, thank you very much for speaking to me and explaining, of course, the Dr. Nomafrench Mbombo, the MEC for Health here in the Western Cape. The province, of course, currently sitting with just over 40,000 active cases, now at its peak of the third wave, and the vaccination of homeless people, those even without identity documents, taking place here at the Hope Exchange, an NGO dealing with homeless people here in the city of Cape Town.